Hello, welcome back. The topic today is viral hepatitis. So those viruses that affect the liver, the main viruses we are talking about, the main viruses that are going to affect the liver, viral hepatitis. Of course, as the name implies, is a viral infection of the liver, where the liver can get damaged. So enzymes can elevate, or the damage can progress into a chronic stage, a severe stage, leading to liver failure and death can even happen. So what are the very common viruses that can affect the liver? Hepatitis A, B, C. Most of the people they know B and C, even hepatitis A. But there are other viruses like hepatitis D and E. So A, B, C, D, E. There are 5 viruses, main viruses, that can exclusively affect the liver. So they are the viral hepatitis. Okay, hepatitis A, again it's a virus that can affect the liver. It's a very self-limiting disease, and usually it's only acute infection. It won't go into the chronic stage, and once somebody gets this infection, they can get lifelong immunity. Usually it spreads to the feco-oral route. That means the infected person excretes the virus in the feces or the motion, and this motion get contaminated with the drinking water or the unhygienic, the person who after passing the using the toilet, unhygienic practice, they touch the others, they can spread to the others. And we have vaccines for this. 2 doses can give lifelong immunity, and usually this disease is self-limiting, and natural immunity is lifelong also. And then comes the hepatitis B. Most of the people know because of hepatitis B. The pregnant women are all screened for hepatitis B. So most of the people they know, and hepatitis B vaccine is being given to the children. It's a compulsory in India. So most of the people know about the hepatitis B virus infection also. It spreads only by blood and blood products, through blood and blood products or body fluids. Even needles. So they are sharing needle, blood and blood products, sexual activity, or something like equivalent to HIV spread. Okay, it is also, we have a vaccine for this. 3 doses can give good immunity. Once people are infected with hepatitis B, they can be either acute or chronic infection. It can progress into chronic stage where it leads to cirrhosis, liver failure, and cancer of the liver can happen. Okay, then comes hepatitis C. Hepatitis C again spreads through blood and blood products. Or sharing the needle, blood needles can spread the infection, and it also can into the acute and infection can lead to chronic stage, where it can progress into liver failure, cirrhosis, cancer. And unfortunately, there is no vaccines available for the hepatitis C, and then comes the hepatitis D. Hepatitis D again is usually spreads to the blood and blood products and body fluids. Usually those infected with the hepatitis B are infected with the hepatitis D. So if somebody has to get a hepatitis D infection, they should be already positive for hepatitis B. And B, C, D, these 3 are blood and blood products spread. These are the 3 things where they can go for chronic stage, liver failure, cirrhosis, and cancer. And B has a vaccine. So once you are protected for hepatitis B, simultaneously you can be protected against the vitamin D. But C, we don't have any vaccine. But B, C, D both have, all the 3 have medicines to control the infection. Then comes the last, hepatitis E. A and E are almost similar. The spread is again through the feco-oral route. That means the infected person passes the virus in the motion, and it can get contaminated with the drinking water or the unhygienic practice. After the toilet, they don't wash properly, so they touch the other person, they can get infected. Again, it's a very self-limiting disease. It can be only mostly acute infection. It won't lead to the chronic stage. And of all the 3, hepatitis A and B has a vaccine, and all others no need for the vaccine or not available. So The hepatitis B, so all the viral of hepatitis, they can give. What is the signs and symptoms? Again, they can give mild fever, jaundice, the liver enzymes are elevated, they get abdomen pain, all those things. So the doctor suspects with a history and examination, he may ask for a blood test. The blood test usually the viral markers we have, or the liver function test, or even sometimes scan, ultrasound or CT scan, to look for the complications, whether there is a cirrhosis or a tumor. All these things the doctors, they can ask for the test and find out what is the real viral hepatitis A, B, C, D, E, and accordingly they can treat you. And A and E usually they are self-limiting and very less severe infection. B, C, D, they can progress from acute to chronic, leading to liver failure and have cirrhosis and liver cancer. Thank you.